So patients are always asking me what kinds of drugs might they get before surgery. And I always tell my patients the first step is to stage your cancer. That means that they need to have a CAT scan of the chest, a PET scan in most cases to show us where the rapidly dividing cells are. A PET scan has imaging that takes up glucose and it lights up areas that are utilizing a lot of glucose, and it shows us where those rapidly dividing cells are. If a patient has sometimes disease that's advanced to be in the category of where they would get treatment before surgery, sometimes that's cancer in the lymph nodes on the same side of the chest. Sometimes that's cancer in the lymph nodes within the lung itself. And sometimes that's bigger, bulkier tumors that are strategically placed inside the lung that we want to try to shrink that tumor before we operate. And in those cases, patients are referred for chemotherapy before surgery, but always they have to be staged first. So there's a very important clinical trial that was published called the CheckMate 816 trial. And if you really want to impress your oncologist, you can quote that trial. That came out in March of 2022. And that trial was pivotal. It changed the way that we look at treating patients for lung cancer, because traditionally, when we treated patients with chemotherapy or chemo-radiation before surgery, that was called neoadjuvant treatment. Neoadjuvant means before surgery. The CheckMate 816 trial was a neoadjuvant trial that treated patients not just with chemotherapy that they might normally get to try to shrink the cancer, but also with a drug called nivolumab. And nivolumab had more effective outcome than treating patients with just chemotherapy. The patients on that trial got 3 cycles of nivolumab therapy with chemotherapy, and the stage of cancer for the patients in that trial was stage 1B or 3A. And stage 1B to 3A is again how your surgeon stages you based on checking the lymph nodes with a bronchoscopy or what we call endobronchial ultrasound, and a combination of CT scan, PET scan, and maybe some other testing. If your surgeon stages you as 1B or 3A or anywhere in between, stage 2, then you might be a candidate for what we call neoadjuvant therapy. And again, that CheckMate 816 trial was nivolumab therapy with chemotherapy for 3 cycles. And the pathologic complete response rate was 24%, which was a very impressive response rate. We have some other clinical trials that were done, including the Keynote 617 trial, the Aegean trial, and the CheckMate 77T trial, but none of those were specific just neoadjuvant preoperative chemotherapy trials. Those other 3 trials were where patients got the drug before surgery, went for surgery, and then had the drug after surgery as well. And in all of these cases, patients did better compared to when they got traditional chemotherapy alone. So we've really changed the landscape of how we're treating patients with other types of drugs and therapies before they go for surgery to try to get all the cancer out, to try to get a pathologic complete response, which means there's no cancer left in the lymph nodes and no cancer left in the lung when it's resected. We know that those patients do the best, and that's always our goal.